If you are over 60 and still masturbating the same way you did decades ago, I need you to hear this clearly. You may be quietly damaging your body every single time you do it. Not because masturbation is wrong, but because after 60, your body no longer tolerates the same habits. I've seen men lose sensitivity, develop prostate irritation, and struggle with erections not from disease, but from one simple mistake they repeated for years without realizing the harm. My name is Dr. Elena. I'm a board-certified urologist, and for more than 30 years, I've dedicated my career to men's sexual and prostate health. I've treated thousands of men in their 60s, 70s, and beyond. Strong, intelligent men who assumed their bodies would age the same way if they just kept doing what once worked. Medicine doesn't support that assumption, and neither does experience. Here's the paradox that confuses so many older men. Masturbation can support circulation, prostate health, and nerve function. Or it can quietly undermine all three. The difference isn't how often you do it, it's how you do it. Small technical mistakes repeated over time change how the nervous system, blood vessels, and pelvic muscles respond. And most men have never been taught this. In this video, I'm going to explain 7 masturbation mistakes men over 60 commonly make that silently harm their prostate, reduce sensitivity, and weaken sexual function. And I'll show you exactly how to correct them safely and naturally. This isn't about fear, it's about protecting your body and your dignity. Before we continue, I want to make sure you stay informed and protected. If you haven't subscribed yet, take a moment to do so and turn on notifications. If this topic speaks to you, type 1 in the comments. Now let's begin with the first mistake most men don't realize they're making. Mistake number 1. Using pornography as your primary stimulation after 60. This is one of the hardest conversations I have with older men because it's deeply personal and often wrapped in shame and silence. Many men lower their voices when they bring it up. They'll look at me and say, "Dr. Elena, I just don't feel the same anymore. Nothing excites me like it used to." They assume their desire is fading because of age. But in many cases, age isn't the real cause. What's actually happening is neurological overload. After 60, your brain changes. Your dopamine system, which is responsible for pleasure, motivation, and arousal, becomes more sensitive to overstimulation and slower to recover. This is normal biology, not weakness. The problem is that modern pornography is designed to deliver constant novelty at a pace your aging nervous system can no longer tolerate. Every new image, every sudden change, every exaggerated stimulus forces your brain to release dopamine faster than it can replenish it. Over time, the brain adapts by turning the volume down. This is why real touch begins to feel muted, why intimacy feels less engaging, why you may need more intense content just to feel a response. And eventually, even that stops working. What concerns me most isn't just the loss of arousal, it's the emotional disconnect that quietly follows. Men begin to feel detached from their own bodies, from their partners, and from pleasure itself. I want you to understand something important. This is not a moral issue. It's not about willpower. It's about giving your nervous system the environment it needs to function well at this stage of life. When men reduce or step away from porn, especially for a short reset period, something remarkable often happens. Sensation gradually returns. Arousal becomes more responsive to touch. Confidence improves. Pleasure feels earned instead of chased. Your body after 60 doesn't need more stimulation. It needs better stimulation. Mistake number 2, masturbating while sitting on the toilet. This is a habit many men mention almost casually, often followed by a nervous laugh. "It's just convenient, Dr. Elena," they tell me. "It's private, it's quick." And I understand that reasoning. But what feels practical in the moment can quietly work against your body over time. When you sit on a toilet, especially if you lean forward, your pelvis is placed in a position it was never designed to hold during sexual stimulation. The hard surface beneath you presses directly into the muscles, nerves, and blood vessels that supply the prostate and genitals. In younger men, the body can often compensate. After 60, it has far less margin for error. I've had patients come to me with complaints that seem unrelated at first. A weaker urinary stream, a dull ache in the groin, erections that feel less full. Many of them are surprised when we trace the pattern back to habits like this. Restricted blood flow repeated over months or years leads to chronic pelvic tension. Nerves become less responsive. Circulation doesn't fully rebound. There's also a psychological component. When masturbation is rushed in an uncomfortable position, the nervous system remains in a guarded state. The body never fully relaxes into the experience. Over time, this trains your brain to associate arousal with tension instead of release. The solution isn't complicated. Your pelvic region needs space and support, especially during arousal. Positions that allow your body to open rather than fold forward encourage better circulation and nerve signaling. Reclining, lying down, or standing upright allows blood to move freely and muscles to soften instead of tighten. Mistake number 3, rushing through the experience. This mistake doesn't look dangerous on the surface. Many men see it as practical. They tell me they're just trying to be efficient. Life is busy. Energy isn't what it used to be. So they rush. What most men don't realize is that this habit slowly retrains the nervous system in a way that works directly against sexual health after 60. When you rush, your body doesn't recognize the moment as restorative. It recognizes it as something to get through. Heart rate increases, muscles tighten, blood vessels constrict slightly instead of opening. This is a mild stress response. The hormones released during hurried stimulation are very different from those released during relaxed, mindful arousal. Instead of oxytocin and calm, the body leans toward adrenaline and cortisol. I've had many older men describe the same strange feeling. They still climax, but afterward they feel drained, flat, or even irritable. There's no sense of satisfaction. They assume this is simply what aging feels like. But aging is often blamed for something that is actually about process. The nervous system after 60 needs more time, not less, to shift into a state where healing and pleasure occur together. Rushing also dulls sensation at the brain level. When stimulation is fast and goal-oriented, the brain focuses only on finishing. Subtle sensations never register. Over years, this narrows your range of pleasure. Slowing down is not about indulgence. It's about alignment with how your body works. Gentle, sustained stimulation allows blood flow to improve gradually. The parasympathetic nervous system engages. Breathing deepens, muscles soften. This is the state where the body repairs itself instead of depleting itself. Mistake number 4, ignoring the pelvic floor muscles. Most men go their entire lives without ever being taught that they even have a pelvic floor. It's not talked about, it's not visible, and until something goes wrong, it's completely ignored. Yet this small group of muscles quietly support some of the most important functions in your body: urination, erection quality, ejaculation control, and the stability of the prostate itself. By the time men reach their 60s, the condition of these muscles matters more than ever. I often see men who are confused by what their bodies are doing. They notice subtle leaks when they cough. Erections don't feel as firm. Sensation seems delayed. They assume these changes are unavoidable parts of getting older. But when I ask questions about habits and muscle awareness, the pattern becomes clear. Many men have spent decades pushing, straining, or holding tension during arousal without realizing the long-term effect. During masturbation, especially when rushed, it's common for men to bear down slightly, almost as if assisting the body toward climax. This reflex feels natural, but over time, it weakens the pelvic floor rather than engaging it. What many men find surprising is how quickly awareness alone begins to change things. When you learn to gently engage the pelvic floor, the same muscles you would use to stop urination midstream, you bring circulation and nerve activity back to a region that has been underused and overstressed. Holding that contraction briefly, then releasing it fully, teaches the muscles to support arousal instead of resisting it. Over time, this improves erection quality and helps restore a sense of control many men thought was lost. Mistake number 5, getting frequency completely wrong. This is one of the most common questions men ask me, usually in a quiet voice. Dr. Elena, am I doing it too often or not doing it enough anymore? The truth is, after 60, frequency matters far more than most men realize, and getting it wrong in either direction can quietly affect both the prostate and overall vitality. Some men masturbate frequently out of habit rather than desire. Too much stimulation without adequate recovery can leave the prostate irritated and inflamed. Testosterone levels don't fully rebuild. energy feels lower. These men often tell me they feel tired afterward, not relaxed. On the other end are men who go long periods without any sexual stimulation at all. But complete inactivity creates its own problems. Circulation slows. Nerve pathways receive less stimulation. Tissue can lose elasticity over time. What complicates this issue is that there is no single number that applies to every man. However, in my clinical experience, many men over 60 benefit from moderation, not extremes. A rhythm that is intentional rather than compulsive, regular enough to support circulation and prostate health, but spaced enough to allow hormones and energy to rebuild. When masturbation happens with awareness at a pace that respects recovery, men often report better erections, clearer desire, and a sense of balance rather than urgency. Mistake number 6, applying too much pressure or force. This is the mistake I see cause the most long-term damage, and it almost always begins with good intentions. As men age, sensitivity naturally changes. What used to feel effortless now takes longer. So many men respond instinctively. They grip harder, press more firmly, or use rougher stimulation. I want to be very clear here. This instinct is understandable, but it is also dangerous. The nerves in the penis are extremely delicate, especially after 60. They are designed to respond to warmth, rhythm, and gentle pressure, not force. When excessive pressure is repeated over time, it creates microscopic injuries to nerve endings and surrounding tissue. These injuries don't cause sharp pain, so they often go unnoticed. Instead, the damage shows up slowly as reduced sensation, delayed arousal, or erections that feel less responsive. I've had men sit across from me and say, "Dr. Elena, it just doesn't feel the same anymore." They assume their nerves are dying. But when we look closely, the issue is often mechanical trauma from years of overstimulation. What restores function is counterintuitive but powerful. Gentleness. Slower movements, lighter pressure, giving your nervous system time to respond instead of demanding results. Men often tell me, this feels unfamiliar at first, almost uncomfortable, because it requires patience. But when they persist, sensation begins to return, not suddenly, but gradually and naturally. Mistake number 7, masturbating without emotional connection or intention. This is the mistake that's hardest to measure because it doesn't show up on a lab test. Yet, I believe it affects more men after 60 than any of the others. Over time, masturbation can become automatic, something done out of habit, boredom, or loneliness, rather than genuine desire. When that happens, the body still goes through the motions, but the deeper systems that create restoration and emotional satisfaction remain quiet. I've listened to men describe this feeling in different ways. Some say they feel surprisingly empty afterward. Others tell me they finish and immediately feel tired or disconnected, as if something was taken from them instead of returned. When masturbation lacks presence and intention, the hormones associated with bonding, relaxation, and well-being are barely released. Oxytocin stays low. Dopamine doesn't restore motivation. The nervous system doesn't shift into a healing state. I often tell my patients that self-pleasure doesn't have to be mindless to be healthy. Even when you are alone, the body responds powerfully to attention and respect. When men approach the experience with awareness, slowing their breathing, noticing sensation, appreciating that their body can still respond, something changes. There is also dignity in this approach. After 60, many men struggle quietly with feeling invisible or less connected to their bodies. Bringing intention back into this moment restores a sense of ownership and respect for oneself. Final message. If you take one thing away from this conversation, let it be this. You are not broken, and your body is not failing you. What it has been doing quietly, patiently, is asking for a different kind of attention than it needed when you were younger. Aging does not erase vitality. It simply changes the rules by which vitality is maintained. And once you understand those rules, everything feels less frightening and far more manageable. For many men over 60, the greatest damage does not come from a medical condition. It comes from repetition without awareness, from doing what once worked without realizing the body has evolved. I want you to hear this clearly. Your sexual health is not separate from your overall well-being. It affects your confidence, your mood, your sleep, and the way you move through the world. When masturbation is done with care, intention, and respect for how your body functions today, it can support circulation, calm the nervous system, and reinforce a sense of dignity. There is no need for shame here. None of these topics make you less of a man. In fact, choosing to learn and adapt at this stage of life is a quiet form of strength. Change does not need to be dramatic to be effective. Small adjustments practiced consistently create momentum. Gentler touch, better positioning, slower pacing, awareness of your muscles, respect for recovery, emotional presence, a healthier mindset about aging. If you've noticed changes, less sensitivity, weaker erections, less satisfaction, don't assume the chapter is closing. In many cases, it has simply been written in a language your body no longer speaks. Learn the new one. Give yourself patience. Your later years are not about decline. They are about refinement. And the choices you make now will shape how strong, confident, and connected you feel moving forward. Remove these words,